One of the biggest misconceptions in nursing is that career progression stops at ward management. The reality is that nursing can take you into executive leadership, advanced clinical practice, education, research, consultancy, and even national healthcare policy. Let's look at Band 7. Typical roles include ward manager, clinical nurse specialist, and nurse educator. Band 7 nurses bridge the gap between clinical practice and leadership, managing teams and ensuring clinical governance. Skills required: leadership, conflict management, and deep clinical expertise. The benefits include greater autonomy and access to management training. Moving to Band 8A. Roles like matron, service manager, or lead nurse come into play. Band 8A. Nurses oversee multiple departments, focusing on workforce planning and regulatory compliance. Many advanced clinical practitioners work at Band 8A, performing assessments and prescribing, comparable to junior doctors. Band 8B shifts focus from the bedside. You might be a senior matron or head of nursing, leading entire clinical divisions. Responsibilities include managing multi-million-pound budgets and large-scale service redesign. At Band 8C, you're shaping organisational strategy as a deputy or associate director of nursing. Decisions at this level affect thousands of patients and staff, focusing on workforce transformation hospital-wide. Band 8D leaders, like directors of nursing, sit at the highest operational levels, influencing entire NHS trusts. They are responsible for clinical governance, patient safety, and the overall organisational culture. Band 9 is the highest NHS pay band. Few reach it, but those who do operate at board level. As a chief nurse or executive director, you're creating long-term strategic plans and ensuring safe care across the organisation. This role involves significant financial accountability and addressing national staffing shortages. Band 9 leaders have national influence, collaborating with NHS England and government agencies. Beyond Band 9, you can reach the level of National Chief Nursing Officer, advising on policy at the highest levels. You could lead in universities, work as a global consultant, or drive international initiatives with the WHO. Reaching senior bands brings financial growth, leadership influence, and the chance to build a lasting legacy. However, leadership isn't always easier. You'll face budget pressures and difficult workforce decisions. The roadmap is clear, from Band 5 to Band 9. But remember, you can also specialise in research or policy. Nursing is unique. You can go from bedside care to executive leadership without ever leaving the profession. Your career doesn't stop at Band 6. The opportunities are far bigger than most nurses realise. If you'd like more NHS career guidance, leadership advice, and nursing education content, don't forget to follow and subscribe.